This afternoon we have Dr. Fahd Rawra with us, and he's going to be talking about different signs that you can see within children, signs of violence, and whether or not you need to seek help. And he's going to try to explain it to us here in the time that we have, but also a couple of different disorders is what he's going to be focusing on. So good afternoon. Good to see you. And there are two, right? Two disorders that you want to focus on.
That's correct. So basically I realized that more recently there's been increased incidents or increased violence in the community. And some of these incidences have been because of children being involved, inciting the violence. I do want to clarify first and foremost, these are not the only two disorders associated with violence in children. And the two disorders are Oppositional Defiant Disorder and Conduct Disorder. Is
there one that's worse than the other?
The Conduct Disorder is actually a little worse than the Oppositional Defiant Disorder. So Oppositional Defiant Disorder, as the name suggests, children are oppositional. They're very defiant. They have problems with people in authority whenever they're given any sort of task to do or rules set up for them. They like to argue a lot. They generally seem to be very angry, have temper tantrums, just overall very difficult to manage that way. And they can be vindictive as well. So they hold on to grudges, blame others for their shortcomings.
And all of that so far doesn't sound violent, right? I mean, is there a step that takes it to the next level?
It actually brings it to the next disorder. Gotcha. But there's signs of it in the Oppositional Defiant Disorder. Basically, all these symptoms have to come together where they are causing some sort of or problems with your functioning in any social setting, whether it be at home or at school. So I'm going to talk about the Conduct Disorder, which is obviously more severe. Children are very aggressive. Aggression can be verbal or physical aggression toward other people or toward animals. So verbally it could be bullying, threatening. Physically it could be getting into fights, using weapons, not just guns and knives, but even things like bricks and bats, things that can actually cause serious damage.
Sure, anything that can be a weapon.
Yeah.
So if you start seeing that stuff, when do you seek help, and who do you ask for help?
Well, if it's at home, usually you'll see some of this stuff happening at school as well. Children, they'll be going to school. Somebody will get concerned, teacher, other students. You know, the child may be being brought in to the principal's office more often, going to detention a lot. I guess the big question always is how does this happen? So there could be some dysfunction at home. They may be learned behaviors from what they're seeing the adults around them, what they're doing. Abuse at home. So it's very important for us to take this seriously and try to get some people involved. They can maybe go to their house, make sure that there's no abuse going on. The child's not being sexually abused or emotionally, physically abused. That's how you would, I guess, go about treating it.
Sure. All right, we're out of time, but thanks. The two disorders to kind of put on your radar, and we appreciate you talking about them with us this afternoon. You bet. We're back here in a couple of moments. The Food Crew up next.